Hi everyone. Thank you so much for inviting Elspeth and I to join you today. It's fantastic that you're interested in our paper. Um, so we well, first I should say a few words about myself. I'm a researcher in the rheumatology research group in the University of Birmingham. My background is in psychology, but we're a very multidisciplinary group, and our research covers everything from discovery science, experimental medicine, and also health services type research. And I'll just move on to this slide, which introduces our Rheumatology Research Patient Partnership. So this is a group of patients who collaborate with all of our researchers in the research group. So I'm the academic lead for this group, and it was established in 2014. So it's been going for quite some time. And we currently have about 56 patient partner members who all have rheumatoid arthritis or lupus or Sjogren's disease, which are the main areas of research focus of our group. And really, the R2P2 is what makes the Student Alliance work. So it's important to start off by acknowledging that and thanking everybody involved. So, Elspeth, would you like to introduce yourself before I start, or?
Yeah, I'll do it now and then it's over and done with, isn't it? I'm Elspeth Insch. I do have a doctorate, but it's nothing to do with medicine. I'm really a geographer, so I'm very interested in your Rocky Mountain areas because glaciers were my specialism. I've lived in Birmingham most of my adult life, and just at the point that I retired, I went down with rheumatoid arthritis and was very ill. I had actually moved away from the city where I'd worked to the countryside after about 4 years and uh, long trips to actually 5 different hospitals. Decided to come back to Birmingham, and I lived very close to the university and the Queen Elizabeth Hospital, which are just over the road from one another. And in my first outpatients visit, the consultant I saw said, would I be interested in being a patient partner with the department, which I said yes to. And then after a bit, the Student Patient Alliance started, and we took off from there, really.
Thank you, Elspeth. Okay, so I don't think I need to spend too much time for this group introducing why patient involvement in research is important. I think it's now very widely accepted that involving patients in research not only makes it more accountable and democratic, but also increases the quality of research in terms of its efficiency, its relevance to patients' need, and its ethical design. And the bottom line, of course, is that most funders are very tuned into this now, and so research that involves patient collaborators is much more likely to be funded. But involving patients in research for my kind of research as a psychologist is very straightforward because I work with things like survey methods and interviews, and it's very clear to me and very easy how I can effectively work with patients to develop those methods in a meaningful way. But for a lot of the research activities in our group are involve laboratory-based basic science. And some of our researchers sometimes find it more difficult to find meaningful ways to involve patients in that kind of research. And so back in 2016, It seems like a long time ago now. I can't quite believe it's that long ago. We brought together patient partners across three different universities. So not only Birmingham, but also Glasgow and Newcastle universities, who were our collaborators in a research into inflammatory arthritis centre of excellence, which is funded by the charity Versus Arthritis. And we had a meeting which brought together patients and researchers across all three universities to really try and pin down how we could work more effectively with patient partners, particularly in basic science projects, laboratory-based science projects. And the proceedings of that meeting were written up. I can circulate these slides afterwards if you'd like the links to look at the papers. But one of the key findings that came from that, I think, from my perspective at least, was that patient partners felt very strongly that involving patients in research should be something that's introduced to researchers at the very earliest stages of their training. I mean, back in 2016, there maybe wasn't such a wide acceptance of the importance and relevance of patient involvement in research. It was still something that was fairly novel, and we were kind of working out how to do it well as we went along in some ways. But that was something that really wasn't happening at that time. And it's something that we took to heart. And, you know, a lot of our research is delivered by doctoral students, and it wasn't standard practice for students at that time to receive training or experience of patient involvement in their projects. So, as I said, we took it to heart and we decided to try out a sort of trial run, if you like, or a pilot scheme of what at that time we called a buddy scheme, where we buddied up or partnered up patients and students. And we tried this out with three new doctoral students, three PhD students, who were all based in the laboratory doing basic science projects. And one of the first things that we learned, that everyone told us, is that nobody liked being called a buddy, and that buddy scheme was not the right name for the initiative. So we consulted with all the patients and students involved and came up with the alternative title, which sounds much more formal, of the Student Patient Alliance. And so this started in 2018. And it began with a kick-off meeting where we introduced the students to patient partners. We had a lot of interest from patient partners in this. So although we originally intended to partner each student with one patient, actually because so many patients wanted to get involved, we were able to partner students with two and sometimes three patient partners. And at that meeting, we gave the students some guidance on patient and public involvement, and we pointed them in the direction of some training resources that were available to them, and also some guidelines on activities that they could usefully do, that they could work together on with their patient partner as part of their PhD research. So our expectations for the students really were that after this initial meeting, that they would lead the patient involvement activities, that they would be responsible for contacting their patient partner and initiating activities as they wish, and also to arrange for payment for their time, and to provide them with feedback on the impact of any interactions that they had. And to facilitate this, we asked the students to record their involvement activities and also the impact of those patient involvement activities. And I'll come back to that in a second. But we asked them to to work together on at least one of a number of activities, and that could be developing a lay summary of their research project, or writing an article for our website, for the Patient Partnership website, or creating a poster or a presentation. It was really up to the student and the patient partner to choose what they wanted to achieve together, and how they wanted to do it. All we asked was that they chose at least one of those activities, and worked together on it. And then after, I think, about 18 months, we met up again. This was just before the pandemic, so we were fortunate that we were able to meet up in person, to discuss really how things were going, what people had been up to, and how they felt it had impacted them. But our main objectives really were to introduce the students to patient and public involvement and give them some experience, of working with patient partners, and also to learn about what it's like to have, a disease like inflammatory arthritis. Many of our students don't come from clinical areas, and may not ever have met anybody with the disease area that their research is focused on. So those were the main objectives. And then after that initial meeting, and the resources we were able to share, so Elspeth and her patient partner Johnny produced some additional guidelines on how to make an effective poster, for public engagement with research findings, which we were then able to share with other students, subsequently. And we also asked for help from the students and patient partners involved in the pilot scheme to develop some feedback forms to capture, the how their interactions were going, that we could use for future students and patients. So this is an example of the type of the way that we ask students to record their, interactions with patient partners, partly because, that will make it easier for them to report on it and write it up in their research reports, but also because we wanted to guide them towards good practice in, reflecting on meaningful ways of working together, and also good practice in terms of providing feedback to their patient partners, about how they were impacting on the researcher, the research project, and so on. Because we know that lots of patient partners who are involved in research often say that they don't get feedback like that enough, and we wanted to make sure that that's something that our students were mindful of, and tried to address from the very start. So, I have to say that the three students and all the patient partners that were involved did some amazing things together and achieved some really wonderful outputs. So, this first picture here is of our student Johnny Lewis, who worked with Elspeth to develop a really fantastic presentation, which was delivered, at the annual meeting of our patient partnership group, R2P2. And other students produced lay summaries of their research, which they co-wrote with their patient partners, and these were published online. Some of the students took part in some public engagement activities. So, you can see here Georgiana, another student, attended a really wonderful patient engagement event where she did a stand that involved really interesting ideas like skeleton gingerbread men, which are actually looking quite appropriate for Halloween. I might try to get her to make some more because she's still with us. And also another fantastic achievement of Johnny and Elspeth, that it was to produce a poster, about Johnny's project, which won an award. So, that was fabulous for both of them. So at the when we met to discuss how things went, we recorded the findings so that we could reflect on the benefits and any difficulties encountered by both patients and students. And the students reported that they felt that they had a greater understanding of patient involvement through having a patient partner, and also a greater understanding of the disease area and what it was like to take treatments for the disease that they were working on. And also, as we've seen, they felt that they had improved their public engagement skills. There were lots of examples of really excellent public engagement activities, as we've just seen. And one thing that maybe we weren't expecting, which was really nice to hear, was that some students felt that it really increased their motivation for their research project. So at times when things weren't going so well in the lab or something like that, having an understanding of why their research was important to patients really helped them to stay positive and stay on track. And also for some students, I mean, they're very young adults in some cases. One or two of our students were away from home, from their home country for the first time, and I think they also appreciated having an independent adult mentor, if you like, who wasn't part of their supervisory team. Okay, and so Elspeth, I think I might hand this slide over to you. So just to describe the benefits that the patient partners experience.
I think it was a really good scheme. I mean, I was very lucky with my allocated students, and I'm very pleased that Johnny has come back to work in the department now. So, that's quite a long-term connection there. For me, it was a real interesting thing to do. It was a way for me of uh, saying thank you for my return to health, because I had been terribly ill once I got the RA. And I think because I was a teacher in my working life, again, being paired up with a student was absolutely great. In a way, it came naturally, but I don't think that matters because everybody brings different things. But for me, that was something that I really enjoyed, going back into that mentoring student adult kind of role. It was also something that I found really academically challenging. The whole involvement that I've done, not just with the students, but with some of the staff of the department, has been really stimulating, but really taken me out of my comfort zone. So I think it's good for staving off my dementia. Not that I know I've got it yet, but I might have, you never know. But I've really enjoyed meeting with the younger people. They've really, in a way, almost helped me stay young in a funny kind of way. But I've also enjoyed working as a team with them, being valued as an adult, which often doesn't happen when you're retired in quite the same way that it might have done in your working life. And I've particularly said to Marie the other day, it's also been quite fun seeing my name in print. But I feel that I have helped with some of the presentational skills, with lay summaries, and also particularly, I think, with presenting slides to a mixed audience, because we've had some conferences that have been a wider group of researchers than Birmingham, and those have been to clinicians, researchers at a very, very high level. and to patients at the same time. So trying to generate slides that aid a talk that's a real challenge. So I think it's been absolutely fantastic thing to do. I feel I've made friendships through it, and I've gained far more than I gave. So it's really good. I think
Thank
that's
you.
me.
That's fantastic. And I mean, you've given so much to our our research that, I'm really pleased that you feel that you've gained as well, because we certainly have. Okay, so I think we all felt that from the experience of the pilot scheme we did, that but both the students and the patients involved felt that it was a good thing, that they'd benefited from it. Um, Although no one reported that they experienced any issues or challenges, we did reflect on problems that might arise, and we agreed that some students might not feel comfortable with leading a relationship with a patient partner. Not everybody has the confidence to do that, and of course, we're people, and people are all different, and some partnerships work better than others, and that could be a problem in some situations. But then that applies to most partnerships in life, both academic and professional. So, that's just one of those things. But an important point that I think we did address going forwards was that some patient partners might have very strong views about using animals in research. And of course, quite often laboratory research does involve animal models. Um, and that it we agreed it was an important thing to do if we were going to roll this out in future, to manage expectations around that from the start, so that to ask people what their preferences were, and perhaps make sure that patients weren't matched up with students who were doing that kind of research if they had strong views about that. So after the success of this initial pilot program, we decided to roll the Student Patient Alliance out across all of the different centres of excellence that we were collaborating in. So that includes the RACE, or the Research into Inflammatory Arthritis Centre that I already mentioned, but also bringing in our Centre for Musculoskeletal Aging Research, which involved the universities of Birmingham and Nottingham, and also some of the PPI groups supporting our Biomedical Research Centre in Birmingham, which is funded by the National Institute for Health and Care Research. So in total, we had 20 students involved and 20 patient partners, although over time, one of the students had to take a leave of absence, and two of the patient partners needed to drop out. So I think one patient partner ended up supporting two students. And then after about 6 months, we asked all of the patients and the students involved to complete the feedback forms that we developed with the patients and students who took part in the pilot scheme. Other than that, because we were rolling out across other centres, we provided all the centres with the guidance and that we had given to the students and patients who took part in the pilot scheme. But matching patients and students up was handled locally at each centre by a PPI lead. So in some sense, we kind of lost control a little bit of how that was managed, but we provided as much support as we could to ensure that there was a consistent approach across all of the different universities that were taking part. So I'm just going to, in the paper, we describe the the results of those feedback forms, and so I'm just going to go over some of those findings here, but you can, if you're interested, you can read about them in more detail in the paper. These are some of the responses from the student participants. And most of the students who took part agreed that taking part in the Student Patient Alliance had increased their knowledge about patient and public involvement, and also increased their confidence to communicate about their research with members of the public. So those were important objectives of the scheme. So it's good that the majority of people who were taking part felt that that was happening. Not so many of the students felt that working with a patient partner had changed their research design, which is actually not really surprising, because the way that these studentships were funded would mean that the research design was more or less laid down at the point at which the project was funded, which happened before the students were even recruited. And so that wasn't really an objective of this particular initiative. However, I should say that certainly in the race Centre of Excellence, patient partners were involved in decision making about which student projects got funded. And of course, the funders would have involved patient partners in making their decisions about which centres got funded. So patients were involved at that level, but at the very local level of our alliance, I think it's fair to say that it was there probably wasn't much scope for patients to be impacting on the design of individual projects. And also some students felt that they had, well, most of the students felt that their knowledge of patient priorities for research had increased, and fewer reported that taking part in the SPA had changed their research plans or their career aspirations or their understanding of research ethics. But pretty much all of the students felt that their understanding of the disease area that their research focused on had increased, and improved their understanding of their research from the public's point of view. And it was good to see that at least half of the students would recommend a similar initiative to other students. So in some of the free text responses that we recorded, some of the students reported that they felt much more confident talking about their research to members of the public. And I think increasing public engagement skills is kind of really key benefits across the board of these kind of partnerships. One or two students noted that it takes a lot of time to do this well, which is always a challenge to researchers. But others pointed out that it's worth putting in the effort to take the time to do it, and that they felt they'd got more out of it than it had cost them to give up that time. So just to look briefly at some of the results from patient partners who took part in SPA, all of the patient partners pretty much felt that they were satisfied with the amount of interaction they'd had with their student partner. We were glad that most of them reported that they were satisfied with the amount of feedback they'd had, because that was something that we specifically guided students towards doing. And all but two patient partners felt that collaborating with a student partner had a positive impact on them, that they felt they'd had benefited from the partnership, and were likely to recommend taking part in a similar initiative to other patients. And again, the free text responses were very encouraging. Patient partners pointed out that they felt that they had been given enough information and that the process of introducing patient partners to students and matching their interests had worked well. One patient partner felt that it wasn't truly patient and public involvement in research because the research design was pretty much decided before the student started on the project. And again, that's something we're aware of and is challenging to address when research is funded in this way, where the research design is kind of agreed by at the point at which it's funded. So some of the key discussion areas we talk about in the paper was that for the most part, SPA was valued by most of the students and the patients that took part, and they felt they'd benefited from it. And in particular, students felt they had an increased understanding of patients' needs and priorities and increased public engagement skills. So those were the two key objectives really that we were hoping to achieve with this scheme. So it was good that the reports we received seemed to reflect that was happening. A number of students commented on the fact that it takes time and that can be challenging to achieve. And one or two reported that they found it difficult to find opportunities to work with their patient partners on specific activities. Now, in Birmingham, certainly, we provided students with guidance about things that they could do with their patient partners and encouraged them to do that. And we also shared that information with the other centres taking part, but we don't know for sure whether or not that was provided to the students in other centres. So it might be that there is some variation there in the approach taken. One patient partner felt that things didn't go so well because patient involvement wasn't something that was valued by the student's supervisor, their doctoral supervisor. And I think that's a key barrier, really. Certainly, even though patient and public involvement in research is widely accepted as a good thing, there are still researchers out there who aren't on board with it and don't see perhaps the value in it. And that is always going to be challenging for schemes like this, because if a student isn't supported by their supervisor to do this, then they're unlikely to justify finding the time to do it well. Some students asked for additional training in science communication and public engagement, and I think that is likely to help. And also, we discussed the fact that this is a small sample. There are only 20 patients and 20 students involved. So it's very difficult, although we can reflect on what drives effective partnerships, it's very difficult to draw conclusions about that based on what we've done here. So, for instance, we could reflect that there might have been variations in approach across the different centres, but we can't quantify that and draw firm conclusions about that. And also, as I mentioned before, there's a degree of inherent variability in the experience due to the personalities involved and the different as I said, some partnerships work well, some less well. But that's kind of part of most professional relationships, and actually experiencing managing that is probably no bad thing, even for doctoral researchers. So to conclude, I think there were a wealth of positive impacts that were experienced by the majority of students and patients who were involved. But I think it's clear that for this to work well at a wider scale, really beyond a small group, it needs appropriate infrastructure and support. So I think it helps in Birmingham that we had dedicated staff who have experience of patient and public involvement and supporting it, which might not be available in other centres. And also, we have training opportunities for both researchers and patients that can support this kind of activity. And again, that's something that is really key, I think, for this to work well. And also through R2P2, we have access to a fairly large and diverse group of patient partners. Now, we were supported by PPI groups in all of the centres that were taking part in the scheme, but some of them were perhaps not so large and not so established as R2P2. And obviously, without a larger group of patient partners, then it's going to be difficult to support large groups of students. And also that key point about having support from doctoral supervisors. I think that is essential for this to work. And I think for the most part, all of the doctoral supervisors, apart from one we heard about, were very supportive, but that is a fundamental requirement for this to be effective, I think. So with that, I have to say thank you to all of the authors of the paper, some of whom were our patient partners and the students who took part in the initial pilot scheme, but also to everyone who took part, all of the students, all of the patients and their supervisory teams. And thank you for your interest and for inviting us to share the paper with you. We're happy to answer any questions you might have and also to hear about your experiences of doing similar things.